AORN presents Applying the Evidence. Medication Safety in Perioperative Care, the nurse's role. While the U.S. has the capacity to produce the finest healthcare services in the world, the Institute of Medicine has reported that mistakes in the medication use process are so prevalent in hospitals that on average, a patient will be subjected to a medication error each day he or she occupies a hospital bed. A medication error is defined as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. The root cause of these errors can occur during any of the 6 phases of the medication use process. Oftentimes, errors occur as a result of a system problem, such as poorly designed workflows, ineffective communication, or information sharing at handoffs. In the perioperative environment, the registered nurse is in a position to drive the system changes needed to improve patient outcomes. Since the Institute of Medicine launched the Quality Chasm series that challenged healthcare to become safer, healthcare professionals' knowledge has increased about how the internal system itself predisposes competent individuals to make mistakes. For many years, the 5 rights have long been the standard of medication safety. However, errors still occur, and with surprising frequency.
Medication errors are definitely a focus for us. It can go from the lowest level, maybe as a near miss or something that we caught, all the way up to, unfortunately, a patient death, a patient demise. And so there are several insults that could happen to the patient that fall on that range. So we're always looking at mechanisms, whether they be automated or manual mechanisms, to help the nurse prevent those errors from happening.
Patient safety, and as a subset, medication safety, has really been given a lot of importance today. One of the things that we do in our institution, and I think probably most institutions do, is critically evaluate the errors that do occur. We look for trends. We look to see if certain medications are more problematic with respect to errors. We look to see if there are certain areas, for example, that are reporting medication errors for a particular medication more frequently. And then we try to look at the specific situation and see if there are improvements that need to be made with respect to how those medications are being dealt with.
In the operating room environment, the nurse is faced with a significant amount of challenges to make sure that the appropriate care is delivered to the patient.
No matter what, it's always fast-paced. Even if it's not an emergent case, there's the doctors, there's the anesthesiologists that want everything done like yesterday.
Nursing has to get the medication ready for the surgeon. Nursing has to make sure the medication is appropriately labeled. Nursing has to make sure that when the nurse gives the medication to the surgeon, that the surgeon understands what is being placed in his or her hands. So there are differences with respect to the medication use process between a more traditional inpatient setting and the perioperative setting, and responsibilities vary a little bit because of that.
The nurse's role is to be one of the last stops before something is introduced to the patient. She or he are the last stop.
So nursing is absolutely critical all the time, 24/7 now, to make sure that errors don't take place. It's the front line, it's the key.
The 6 phases of the medication use process are procuring, prescribing, transcribing, dispensing, administering, and monitoring. All members of the perioperative team play important roles in minimizing the potential for errors during all phases.
When you implement what we would call evidence-based practice, you get the nurse involved with looking at the research and the best practice that's out there, and they start to understand why we do what we do and when we do those things. So again, when you involve the nurse in the research, get them involved with reading journals, discussing things at the table, I think we take away that it's a policy versus this is best practice. And so again, our policies should actually reflect what the evidence is saying that we should be doing.
AORN released the Medication Safety Toolkit, Medication Safety Guidance Statement, and Competency Statements in 2005.
This year, we embarked on the project for creating recommended practice for medication safety. We felt that there is sufficient scientific evidence that would support making formal recommendations regarding medication safety in the perioperative suite. Medication administration is one of the most frequent and common things that the perioperative nurse is responsible for. And having a document that provides guidance on how best to do that in the most safe and effective way we possibly can is an important tool for the perioperative nurse to have available to her. A few of the key recommendations relate to the use of multi-use containers, multi-dose vials, issues surrounding medication reconciliation, safe dispensing of medications to the sterile field, and other issues that are unique to the perioperative setting.
Prior to assuming my administrative roles in the pharmacy department, I practiced as an operating room pharmacist for a number of years. So I have firsthand knowledge of the medication use process in the perioperative setting and just the benefits that a pharmacist can bring to that setting. Having a pharmacy present in the operating room really allows pharmacy to prepare the medications that need to be used in the various surgical procedures. It relieves nursing from that responsibility. Nursing can then focus on other activities related to patient care and not have to worry about trying to make up the medications, trying to make the necessary dilutions, and trying to do this in maybe a less than optimal setting.
Making practice changes that require a shift in behavior can be a challenge for any surgical team. Regardless of the scope of change, the nurse is an integral link in the development, adoption, and implementation of new practice standards and technology.
I think that we're starting to see technology brought into the perioperative setting, so technology such as smart IV pumps, anesthesia information management systems, barcode medication administration, automated anesthesia carts. They're starting to be implemented or brought into perioperative settings, and the literature that's out there actually shows that when this technology is implemented in the perioperative setting and when it's implemented correctly, that you can get safety benefits from this additional technology.
So I don't think technology should be seen as an evil empire. If anything, I think the success of nurses going forward will be to embrace technology and to provide their input so that technology will give us what we need to do our jobs better and safer.
By encouraging nurses to come to the table and look at the normal process and say, how can I then bring technology in to support my day-to-day work? How can it help me eliminate some of those errors that nurses make independently? So again, we've had the opportunity to use what we would call bedside med verification. Our orders are received from pharmacy, and that ties right back to what we call our EMR, or the electronic medical record. And again, that technology supports the actual delivery of our medication when we're at the bedside.
The electronic medical record, automatic dispensing systems, barcode medication administration, smart infusion pumps, and other emerging technologies are coming together to improve patient care.
What I would consider a transformational leader's role would be to encourage staff to communicate, to gather as a group, and to discuss potential medication errors or actual medication errors, and then collectively as a group look at how can we improve our processes. It could be a matter of looking at the current day-to-day processes and say, how do we improve upon them? Or is there an opportunity to enhance what we do by bringing something in to support the delivery of medication? By encouraging staff to actually report medication errors, we can actually learn how some of our processes are failing us.
Anything we can do to provide the systems in place, the processes that we do to minimize the opportunity for error is essential for good quality healthcare. I can sit in my office all day long and think about things to change and do. It's not really going to matter. It's not going to have any impact on the outcome. When you go out there and you talk to those individuals on a daily basis, these people know exactly what's going on, and you find out from them what you need to do to improve. That's where you get your best advice. I think that's absolutely imperative that people do that, and we do that constantly.
The perioperative nurse's goal has always been and will continue to be patient safety. He or she is a key player in implementing safe medication practices in the surgical environment. Technology is a tool to help minimize errors, but it can never replace the nurse. From procurement through monitoring, the medication use process includes a broad team of individuals that must collaborate and work together to prevent medication errors.
No one discipline, no one group can really carry this on their own shoulders, that everybody has to work together. And by working together and taking advantage of everybody's expertise in various areas, I think we can really significantly improve the safety of medication use in that setting.
When I think about the opportunity to use technology, I would say it would never replace the nurse. There's always going to be that need for the human touch. The opportunity to talk with the patient, answer their questions, support them as they're learning. Technology can be available if it's going to maybe help us with medication information, but I don't think we'll ever take away the nurse in the medication use process. They're always going to be necessary in order to provide that human touch.